everybody, it's Jenny. I'm coming into the video. I'm doing it myself. So just like I want you to do your own home treatments for pain relief, here I am, and we're going to talk about the feet. So if you have sore feet from running, from wearing high heels, from working, or from poor shoes, or maybe just overuse, repetitive use, you can reduce pain in the toes, the balls of the feet, the ankles, the bottom of the feet, the tops of the feet, the arches, all of the back of the leg, and all of the front of the leg. Everything attaches. So if you hold your hands right here and move your toes, you can feel them moving all the way up in here. So the first thing you're going to do is you're going to soak. Epsom salts bath, and you can look at my post on treatyourselfnaturally.com. You can soak with Epsom salts and nice warm water. You get a nice big tub, fill it with a lot of salt, even more than the bag says, and just soak your feet. You can also do a plunge. Both of those are going to be anywhere from 5 minutes, whatever feels good, to to even 20 minutes. Cold plunge, warm Epsom salts bath. When you're finished with that, you're going to really see what feels good, move things around, flexion, extension, inversion, eversion, pushing, and just moving the toes, spreading them out as much as you can, and then squeezing them together. And then you can sit in a chair and do this, but for purposes of the video, we're going to sit right here. I'm going to use my right foot. And you're just going to go ahead and wiggle the feet. Move them around, check in with the toes, and roll the toes. Some of them are going to be pretty painful, so go gently and be easy with them. But the more that you can manipulate and create space in soft tissue, the better that your feet will feel. So there's a couple of other options that you can do as well, and that would be just to walk your fingers inside and spread the tops of the foot out. Spreading and spreading. And then you can flex and bend your toes up. So you're going to pull them and bend them, or you can bend them down. You can pronate, supinate the feet. Pronation, supination. You can pull on the feet and really stretch out all the way up through the tibialis anterior, tibialis posterior. You can also stretch this way. You can get a strap and place it on the back of the foot and lay down and grab the strap and stretch the feet out that way. So I don't have a strap right now and it's out of the picture. That's okay, we'll show you that another time. The next thing I'd like to show you is rolling the feet. And these are triggerpoint.com supplies, and you can find that resource on my website. This is an excellent tool. You can be seated in a chair or on the floor and roll out the feet, and this is really effective for the arches. You're going to remember to take some deep breaths and roll that foot out, especially in the arch. And these can be incredibly effective if you put a little bit more weight on it, kind of bridge up with the body, or you can stand. Of course, standing will place more weight on the entire foot. And you can find those trigger points. And when you go into a trigger point, you're going to stay there for about 8 to 12 seconds. Nice deep breathing. Find a spot, and you don't want to overdo it. Gently begin working the feet and creating space in those sore spots. It's a little hard to get the heel while you're on the little rollers. I'm going to show you how to do the heel, and I'm going to show you how to do the tops of the foot. So this is the small roller. You can also use the larger roller. The larger roller is a little bit different. It's kind of a more of a surface area, so you can see how my foot flattens out over the roller, and there's a spot right there, and then you can bend the knee, kind of relax. Make sure your posture's good, squeezing the glutes, the abdominals are tight, and just soft. You can do this at your desk at work. I'm going to say, well, I can't afford the triggerpoint.com. These are very expensive. You can get dryer balls. These are great. Or you can get a little ball from like Dick's or any sporting goods that's specifically for foot reflexology. These are excellent tools. Whoa, and they get in even better than the large rollers. But you want to do this gradually. So you'll start with something easy and work your way in. And the more that you can get into a trigger point, that really shoots up into the leg. 8 to 12 seconds, 2 or 3 breaths. And then come out of it. You can go back into it, but don't stay there. Don't overdo it because you'll create pain. What we want is to treat ourselves naturally at home to reduce pain and inflammation, reduce discomfort, create space in the bones, the soft tissue, the fascia. And then this ball is particularly good for the heel. And I'm going to see if I can turn around a little bit so you can see this. This is super good for the heel. I'm going to come a little bit further and just kind of push down in the heel. Yeah, a little bit of rolling and just find a spot, woo, right where the fascia, the plantar fascia, this is excellent for plantar fasciitis. Itis is inflammation, that's all it is. You go in and create some space in that heel, come down a little bit, and on my website in the post for feet, you'll see some diagrams, some things that might help you for placement. But the entire bottom of the foot can be worked that way. So some other options, and these large foam rollers, which I'll use in some of my other videos, these large foam rollers are okay, but they really don't work the feet that well. So any ball will do. You can use a lacrosse ball, a tennis ball. We've got a variety of balls. Racket balls are soft, but for really sore, tight feet, which I run into a lot in my practice, really sore, tight feet, you would start with something softer, something that you can really squeeze. You want to make sure that you do this progressively, gradually, only creating space, wellness with these foundation joints. This is your connection to the earth. It's a lot of bones in here. It's all of the energy from the feet go up into the leg, all the way up through the body. So now for the toes and the heels and things like that, you can use my T-bars, and there's different kinds of T-bars, flat ones, beveled edges. You can use the massage star, and you can just gently stretch the fascia and breathe. And if you come into the arch and some of the other areas along the medial border and the lateral border, you're going to find that it's kind of tender. So you can use direct pressure, and also on the post on the website shows you the reflexology points, gives you some suggestions. Find the place that's sore. If you have a neuroma, you're going to go easy in there, but you want to create space so that the neuroma can release itself, so it can go away, so it can be absorbed and processed by the body so it doesn't stay there. You don't want to keep that frozen. Definitely want to keep that open. And then this is how you would work the heel. And that would be just to place a little bit of pressure right in the heel. And you can go gently, counterclockwise or clockwise, or you can put a little bit more effort into it. A lot of you have a bunch of massage tools at home. Most of you won't be able to do the work that I do on the feet, which can be, you know, it's a collaborative effort with my patient and the work that I do on the feet. There's a lot of breath, there's a lot of breaks, there's a lot of processing. But you can affect change with your feet. Even the toes, all of these points in the toes, just even a little bit of movement you'll be so pleased with the benefits from it. And then the front, the dorsal side of the foot is a little bit more tender. It's a lot of veins, a lot of connective tissue. You're just going to go easy in between these areas. You can roll up on it and press it out and spread it out, smooth it, put a little bit of oil a little bit of lotion. Just don't use anything with chemicals, you know. Just use coconut oil. That's a good one. And open all that up. You can use the beveled edge T-bar. They're not very expensive. You can go in between and whoo, there's a tender spot. The pressure is not that much. It's just a little bit. You can go in between each one and come all the way up. And then you're going to want to work around the medial malleolus and the lateral malleolus. Giving yourself, even you can wring the low legs out. If you have swelling or edema, we want to do some lymph drainage before we do this. So you should refer to my lymph drainage chart. But you can, and there's a post on lymph drainage as well. You can squeeze and open up those legs, working the calf muscles, the gastroc, the soleus, the tibialis anterior, and even the tibialis posterior. This is myofascial work where you're just going to stretch. This is also very good. This will relieve trigger points, tight fascia, painful fascia. It's all very good for you all the way up to the knee. Working all around the tibia bone, laterally and medially. All right, well that is part 1 of the feet. Try it and please send me your comments. Let me know what you think and stay tuned for the next video. Thank you very much. This is Jenny Sprung, licensed neurosomatic therapist, certified zero balancer, and a lot of my credentials are on my website. Thanks for tuning in. All right, I'm going to turn the video off. Yay!